right.
So tell me about the training program from GBC as well as the people you have here.
All right. So every year we really bring the hospital here, the hospital lab, to the convention center. We're not asking people to come up to the hospital to get their lab work done today. We're encouraging them to come right down here to the convention center. We have a lot of our phlebotomists from the hospital as well as some of our nurses. And then we've got a great partnership with the Great Basin College MAPE program. That's medical assistant, phlebotomy, and EKG. So their students are here working at the event, getting some clinical hours, which is great experience for them and really helps us out as well to get some more volunteers here. Last year we did about 695 lab draws on the day of the event. We're hoping to get maybe to 750 this year. That's our goal. But the great thing is it's all free of charge. It's just for community members. It's a great snapshot of their health because you get a comprehensive metabolic panel. You get a lipids panel, which is your cholesterol, your triglycerides. There's a thyroid health screening. There's actually a diabetes screening. It will kind of tell you if you might be at risk at being diabetic or for pre-diabetes. We're doing the PSA, which is the prostate health screening for men, and there's one more in there that I'm forgetting, but I'm sure it's a really important one. So we really just encourage folks to come down and get it done. I do want to tell you, here's kind of a secret. If you can't make it to the health fair today, we're actually going to keep the free lab work available at the hospital until April 5th. We haven't announced that because we really do want people to come down here. You'll probably wait less here at the convention center. If you come up to the hospital, we'll work you into the workflow there at the lab. There's no appointment necessary. You just come right to the lab desk and say you're there for the health fair draw, and they'll get you taken care of, and that's good for 2 weeks up until Saturday, April 5th.
And how much does this cost the hospital?
You know, there's a lot of man hours that go into this, so there's definitely a cost there. All of the supplies, and that's including all the clinical supplies, but also there's snacks, all the good stuff that we're handing out. So there's definitely a cost to it. But at Northeastern Nevada Regional Hospital, our mission is making communities healthier, and this is one of those days where we really get to see that mission lived out. It's lived out every day at the hospital with each patient who comes through our doors, but this is on a bigger scale where really we're contributing to community health. So you can't put a price tag on that. We're really happy to be able to do it.